My name is Maeghan Orton, and I am the Regional Director for Africa for Medic Mobile. And what we do is that we specialize in building data collection systems and relationship management systems for clinics in rural and disconnected settings. Our target market and the problem that we pose, or the problem that we try to fix, is currently the health model in Africa focuses on the community level, specifically community health workers, who are local community volunteers that push patients towards the rural clinics. But those community health workers are typically incredibly far away from the clinics. They also have low literacy levels, and what's most interesting is that they all have mobile phones. And so what we do is we access those mobile phones. We build open source systems for data collection, relationship management, and then also quality improvement at the clinic level, managing and monitoring stock levels, helping with health workforce management and mapping. And most importantly, we help to build relationships between clinics and patients using their mobile phones in intelligent and intuitive ways. Thank you very much.
You use mobile phones, you mean smartphones, or what kind of mobile phones?
We build for feature phones.
Okay.
And we also use ground computing. So our online dashboard, it's called Kajua, actually is installed in a node-based way, and so it actually is fully functional offline, and it can send SMS messaging, it can schedule patients for appointments, it can record patient data, and then you can also export all of that data via comma-separated values and integrate that into another platform such as Data or SPSS for further data analysis.
And you've used it in what markets so far?
We currently have active projects in 21 countries, and I oversee projects in 11 countries. And a typical model would be that a community health worker would register a patient using her feature phone. The data would go via SMS to the installation of Kajua that was at the clinic level, and then the clinician would enroll that patient in the type of care that they needed to receive, whether it be antenatal care or immunization reminders. For example, in our projects in Kurnool, India, at baseline we had around 60% of all mothers that effectively brought all of their children for immunizations, 100%. And then after 6 months, we were at 99% completion with an SMS reminder going to a mother and a grandmother the day before the appointment. And at the end of a year, we actually hit 100%. So 100% of all mothers who walked through the doors of the clinic completed their immunization, and it was just based on really basic SMS engagement with those clients and those patients.
Awesome.
Yeah.
Awesome. Thanks, Meg.